In this section, we will be taking a look at the concept of oxygenation in relationship to COPD management. The objectives are to examine the risk factors and prevention methods associated with COPD and to plan evidence-based care for the individual and family in collaboration with the healthcare team. We will be taking a look at the student learning outcomes of providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations guided by the Caritas philosophy. Communicate effectively with patients, families, and members of the interprofessional team, and manage care for clients and groups in diverse settings. Smoking is the greatest risk factor associated with COPD, as well as chemical irritants and air pollutants, which we'll take a look on the next slide regarding prevention methods, and then also disease management. These are the modifiable risk factors, effective management of obesity, type 2 diabetes, smoking, and stress and anxiety, hypertension, and atherosclerosis. All of those are going to make it more difficult for the body to oxygenate and circulate that oxygen. So if you have effective management of those conditions, it will actually assist with the management of the COPD. When we take a look at the prevention and management strategies, since smoking is the greatest risk, encouraging patients to stop smoking, to reduce smoking, and to avoid secondhand smoke. Motivational interviewing is a very powerful technique, and it's examining and meeting the individual at where they are in their life. So if you can figure out what will motivate them to quit smoking, usually those patients are more effective in stopping smoking and maintaining themselves as smoke-free. Environmental air quality, the air pollutants, because of the thinning ozone layer, more patients are having a difficult time with breathing because of the air quality. So knowing what the triggers are to the decrease in lung function is understanding how to control them. So maybe going outside when it's humid and high temperatures or very low temperatures, if those are triggers, make sure those patients stay inside, see if they have access to air conditioning or the window units for the air conditioning units, if they can't afford the central air. Adding humidification to the home will help with loosening secretions and making it easier for their lung function. Vaccination is another huge prevention strategy. Make sure that they have flu and pneumococcal vaccines. Breathing techniques, a couple different breathing techniques that are effective. Probably the number one is the pursed lip breathing. And that will actually force some of that carbon dioxide outside of the lungs so they can actually bring in more oxygen. Also, accessory muscles are used a lot with COPD patients, especially in an acute situation. So teaching them how to abdominal breathe will sometimes take some of the stress off of their accessory muscles. Hydration is really important because you want them to maintain thinner secretions in their respiratory tract so they have an easier time with breathing. And the recommendation is between 2,000 and 2,500 milliliters a day, or as much as they are able to tolerate. You want to encourage them to improve their activity tolerance. So even though they're short of breath and they may have very limited activity tolerance, you want to encourage them to continue working towards improving that. So gradually improve their activity length and duration that they're able to do will actually help make their lungs stronger. So in the long term, they will have improved outcomes. Nutrition is a concern for COPD patients because a lot of times what happens is they're spending so much energy on breathing that their appetites actually are suppressed. They take in more air with breathing, so they actually fill up on air instead of food. That's actually called aerophagia. And then, so you really want to encourage them to be aware of their nutritional status, maybe encourage small, frequent meals, snacking, healthy snacking choices if they are available. And then lastly, coping. If you can imagine a COPD patient, if you've had experiences with caring for these patients, they have a lot of difficulties within their life because of their decreased activity tolerance, their extreme shortness of breath. They have a sense of a loss of control over what is going on, and they're not able to do nearly anything to the degree of what they used to. So it's very stressful. You need to make sure that they are coping effectively, and also their family is coping effectively, that they have that family support to back them up as well.